Good morning, students. I hope you all are doing fine, taking good care of yourself and your family. Now we have the time for repertory session. Today, the topic we'll be discussing will be the interesting one, and I would like to share here that the topics that we have covered today are going to help you a lot in your clinical practice as well as in gaining a lot of knowledge about the things that we are going to use further as a clinician, as a doctor, as a consultant. So, first of all, the learning objectives that we've kept for today's session will be a little brief about the middle time repertories, where I'm going to introduce you to the middle time repertories, what all things were covered, how they all originated, and all. And a special focus will be given to Dr. Kent's repertory, and the main topics we'll be covering under Dr. Kent's repertory will include about a little history of Dr. Kent's repertory, the philosophical backgrounds covered in the covered uh, with which the help of which the repertory was formed, the way the repertory has been constructed, how the rubrics are arranged, what are the different uses or the different cases where we can use this repertory, as well as the demonstration of certain cases where how can we work and this repertory can help us in working out the cases. So let's move further, and now I would like to start a little about the middle time repertories. If I talk about the middle time repertory, so here I'm going to talk about the time period where the early repertories were already there in abundance till the time we have the latest repertories, which includes the software. And the earlier repertories, I meant the repertories used by Dr. Henneman or the Lipez repertory or the therapeutic pocketbook, as we've read in our earlier sessions about the earlier repertories. So the time period that here I'm talking about, the middle time repertories, this time period is from the year 1897 to the year 1982. That means the time period when the repertory of Dr. Kent, the homeopathic repertory of Dr. Kent, Dr. J.T. Kent came out, and the time till the time the synthetic repertory was published, that was in the year 1982. So this was the time period which was the time period of middle time repertories. There have been many repertories in this time group which came up, and some of them we'll talk about one by one. Currently, I'm gonna ask. Currently, I'm gonna tell you about the reason why these repertories came out. Actually, there had been many repertories in the earlier time period also. The the therapeutic book that we are already aware of, which was one of the most famous repertories of that time. It came out at that time, but slowly and slowly, when we started learning more about repertories, more about materia medica, we came to know that there were certain lacunae in those repertories. So as and when the time went by, there many repertories were published. Some were very popular, some could not make it, and thus a lot of confusion prevailed at that time, like how to use the repertories or which repertory to use. As we all are aware, it is not easy for us to memorize all the materia medica, to memorize all the remedies, all the symptoms of all the remedies, and thus the need of repertory came out. But at the same time, the repertory has to be authentic, the repertory has to be useful, it should be easy to use so as to not cause any confusion. And for thus, when the things started moving further, we came to know about the repertories, different repertories which were prevalent at that time, and thus all those repertories one by one started coming out, but most of them could not make it to the privileged list of being useful repertories, and only few of them were very popular. So that time period when all these repertories were coming up, becoming popular, going back to the stocks, became the repertory, became the era of the golden era of the repertories. That is, this time period of middle time repertories was said to be the era which was considered as the golden era of repertories. So if I talk about some of the repertories which were quite famous at this time, were Dr. J.T. Kent's repertory, then we have Boga Bonning Hassan's repertory. Along with that, Dr. Clark's repertory also came out after that. Synoptic Key is one of the examples of this middle time repertories. So these are certain repertories which were very common, very prevalent, but all of them had certain drawbacks, all of them had certain benefits, all of them were depending that some things were there for different cases, some things were there for other cases. So keeping in mind all those points, we had to use the repertories as per the case which was there at that time, or even today. If I say, depends on the type of case, that the cases, the symptoms that we have in the case, that we have to find out the repertory, which one to use and when to use and how to use. So for that reason, we always need to have a little idea about what all repertories are there, so that we can use it according to the case, and they are beneficial to us at that crucial time when we are not able to select the medicine just looking at the time of case taking. So, and that was the reason only that why we have told that repertories are, one of the benefits of repertories are to help us or to guide us in the way that how to come to a proper simillimum. But remember it, as I've already said, it's only the repertory which guides us. It never lets us decide the remedy. It only guides us towards certain remedies, out of which we are gonna then decide the final remedy. So let's move forward. This was a little introduction about the middle time repertories that I've told you, and certain important points in them which you all need to remember, why all those things came out, what was actually the need of so many repertories when already there were so many prevalent repertories, what basically was the time period when, or what was the time period that when we say that the middle time repertories were prevalent. So all these things have actually helped us in coming to the further advancement in repertories. Now today we are going to talk about one of the most famous, one of the most accepted, one of the most prevalent repertories in our homeopathic practice, which is the repertory of Homeopathic Materia Medica by Dr. Kent. This repertory, I'm sure you must have seen this repertory. You all must have gone through it once till today. But here, if you compare this repertory and the other repertories, you will find a lot of differences between this and the others. We'll study about it. How is it different? Why is it different? That we are going to study when we are going to study this repertory in detail. But this is still one of the most commonly used repertories in today's world, as this has been found to be one of the most easiest using repertories till date. Even all those people, like when now we have latest repertories, but still, even if you go ahead with the computer softwares, you'll still find many people just go back to look at the Kent's repertory. Some people go back to look directly at the Bonning Hassan's repertory, just because these repertories have certain characteristics which make them so prevalent. They have certain highlights which actually which actually help us in coming to the coming us to the selection of the group of the remedies which will lead us further to the final selection. So today I'm going to start the session about the Homeopathic Materia Medica by Dr. J.T. Kent. And when we move forward in it, we'll learn more about this repertory, and then we'll start comparing this with other repertories to learn about the efficacy of this repertory. Now, if I want to talk about certain things, first of all, a brief introduction about Dr. Kent's repertory. So here, let's start in a way that Dr. Kent, as we all are aware, was initially not a homeopath. He was an eclectic physician. And around the year 1878, when he turned to homeopathy. Now, what actually happened during this year was that when his wife fell ill and she didn't respond to any of other treatments, at that time homeopathic medicine helped her, and this incident turned Dr. Kent to homeopathy. After 1878, he started reading a lot about homeopathic literature. He started reading a lot about homeopathic medicines. He started reading all the work of Dr. Henneman and was quite convinced that the way homeopathy has been explained, it is very effective. And thus, slowly and slowly, he started practicing homeopathy also. Not only practicing, he also started teaching homeopathy also. So with that kind of an exposure, he was so much convinced with the principles of homeopathy, with the principles of Dr. Hahnemann, that he further went ahead and started writing his own books. During this study time period of Dr. Kent, if we see a little more detail about this thing, we'll come to know that he had a great belief in the potentization power of homeopathy. He was the one who actually started over with it, that we need to go ahead with the potentized medicines too, and not only the lower potencies. Dr. Kent was the physician who is believed to have started over the further belief of higher potentized medicines being more useful, specifically in chronic diseases. I'll move further when at that time I'll tell you about a doctrine also which they have mentioned about this. So here, if I talk about Dr. Kent himself, there you'll come to know that he actually worked a lot in the field of homeopathy, and he brought it forward to a great extent. I would request all of you to go once through Dr. Kent's philosophy, which is there in your organ of medicine. I'm sure you must have read it earlier also, and also some of his literature work. There, if you go through it and you read it, then you will come to know about that what all actually things were there that he has worked on it. And then only you will be able to understand that his principles were very much similar to Dr. Hennemann's principle. He kept the initial base as Dr. Hennemann's principle, but after that he started moving forward, and with his own belief he started moving ahead, that yes, homeopathy works, and it works wonderfully even with highly potentized medicines too. It doesn't only work in the lower potencies or in the material doses, even with the higher potencies, with highly potentized medicines, it does work. So this was a little introduction that I wanted to give. If I talk about Dr. Kent's repertory, it was his own work that he had done for it. He actually used to follow a lot of repertories earlier also. He used to read a lot of repertories. One of the main repertories in it was Dr. Lippe's repertory. So when I'll discuss further about the plan, at that time you can see that the plan of Dr. Lippe's repertory was almost same as we find in Dr. Kent's repertory. Although there are major differences in the arrangement of rubrics, in the way the medicines are mentioned, in the way the rubrics are given and the sub-rubrics are given. But but the basic plan remained the same as was with Dr. Lippe's repertory. He started reading on Dr. Lippe's repertory. He started working on other repertories also. So while going through Dr. Lippe's repertory, he found many lacunae in it. He found one or the other things were missing in in almost all of the things. So what he used to do, he always used to mark the things on the margins so that he can further remember it. So he always used to mark the margins, make the markings on the margins, add the notes on the margins. So that is how the things started moving about his repertory. Now, one of the doctors once just came to Dr. Kent and saw this work that he had done. And that work, he was so convinced that, and that doctor was Dr. Bigler. So when he studied this work, he just asked Dr. Kent that why don't you publish it? It's such a wonderful work. It should come out in the public and it should go ahead with the things. At that time, what actually happened was that Dr. Kent was not in a position to go ahead and publish that work. So he asked for help from some other people also. But the first edition of Dr. Kent's repertory, which came out in 1897, it came out in certain parts. It couldn't come out as one full because the things were not suitable for him at that time. So it came out in parts. But slowly and slowly, when the things moved further, you'll see that these things later moved ahead and further editions were published. So with first edition, when you'll see Dr. Lee has also worked a lot on that edition. But Dr. Kent and Dr. Lee started this repertory together, but Dr. Lee could not make it to the end. He became blind in between, and thus Dr. Kent only himself took over whole the work and finished it, and then started giving the repertory published in parts. So that was the first edition that I was talking about in 1897. Slowly and slowly, other editions came. So one of the editions, the second edition came in 1908, which was considered again the improvised version of the first edition. Then after 1908, if we see, the third edition of Dr. Kent's repertory actually came in 1924, although Dr. Kent died in 1916. So this edition was actually the work of Dr. Kent, but later published by other people. So before the third edition, when the second edition came out, Dr. Kent again started working on improvising his second edition. So there, when we'll see, where you'll find, if you could find the earlier books, you'll see there it has been written that Dr. Kent used to write about improvising it on the book itself. So when the third edition came out, all those changes which Dr. Kent had done were taken to the third edition also. Similarly, certain physicians of the old time, those who have this original handiwork of Dr. Kent, it is said that they have this work in Dr. Kent's handwriting itself. So they were the one who actually worked over it and then slowly and slowly improvised it, and later came ahead with the things that how to improvise it, how to revise it, and then they published it. So that was about the third edition, which came in 1924. Later, third, fourth edition, fifth edition, and sixth edition also came. Now, if you see your repertory, what we are having right now, you'll find it to be a sixth edition. This is the American sixth edition, which came out in 1957. But the Indian edition of it came out in 1961. So what we are having now is the Indian edition of 1961. So this is mentioned right there in the repertory. You should always go and see to it what edition you are reading, because it is important also for us to understand each edition carries certain changes with it. So we all need to see what changes are there, what all changes were made, so that we can understand why this edition came and what is difference in the other edition, which one is more helpful for us. Okay. Now, if I move further, When in 1961 this repertory of 6th edition this came, after that there have been, has been said that people still started revising the Dr. Kent's repertory, still started making changes in it, but all those repertories never make it to the repertory of level of Dr. Kent. It has always been said that the repertories which later came were named as first general repertory of Kent, but it was never mentioned as Dr. Kent's original repertory. It has always been the first general repertory of Kent. So that is how a brief we want to know about Dr. Kent's repertory, how he struggled in it, what all the difficulties he faced while going through his repertory and other things. Now, certain principles we are aware of Dr. Kent's, like you have gone through the philosophy, you already know Dr. Kent's philosophy, you are aware that Dr. Kent's philosophy has a lot of things in it which were originally of Dr. Henneman's and further revised, improvised by Dr. Kent. So accordingly, if I see, if you go through the philosophy, you go to the principles of Dr. Kent, and you'll see there are certain very important rules which he is mentioned for the clinical practice, and those principles only he has mentioned in his repertory also. So if I want to name a few, I would say there has been a principle of doctrine of series and degrees. This principle is used when Dr. Kent was writing up this repertory also. He believed in this principle to the T, and that is why these things he has mentioned in his repertory also, in his philosophies also, in his literature also. All these things are mentioned. So if I talk about series and degrees, it's a very beautiful principle that they've mentioned, and it holds true to a large extent even in our clinical practice. The series in degrees principle is actually the one which helps us in practicing further, specifically in the chronic cases. This principle, which the series of degrees mentioned, is actually, if I want to quote it in Dr. Kent's word, I would say that what he said was that just as there are octaves of musical tones, so there are octaves in the simple substance through which severally it is possible to correspond with the various planes of the interior organism of the animal cells. That is, as we all are aware, there are there are 8 octaves in a musical plane. Now, if you ever go through it, if you ever go through a musical instrument, what you've seen is each and every one of them gives a different sound on a different pitch. But when you play all of them together one by one, that is, one after the other, if you play them, what you will see is the pitch of the sound goes from lower to higher. Similarly, the octaves which come in one of them, one after the other, which comes, also have a higher note. So that is how, even in our homeopathic practice, if we are starting with 30 potency, later we can move to the higher potency, and it's gonna increase the chances of your cure further. But you should know where to pull a full stop. You should know how and where to stop. That is also important. All these things come through practice, but still always keep this in mind. Whenever we are moving to the higher potency and we see the patient is reacting, that doesn't mean that we need to give the next higher potency at the next stage. No, we have already learned about Dr. Kent's observation, where he has told when to use the higher potency and when to stop. So that is the thing that he's mentioned in his observations also, and that is the thing that he is coming up in this series and degrees also. He is told we can use 30 potency, 200 potency, we can move further to 1M, 10M, cm, anywhere we can go. We can move till mm also, but that doesn't mean that going higher means the patient is receiving a highest cure. No, going higher means once the patient has come to a certain level, now we have given a certain potency, the patient has reached, his symptoms have reached to a certain level. Now we need to see its amelioration. If it is an amelioration, then what is our first step? Do we need to move further with the higher potency, or we need to stop there only and wait for more time? All these things are mentioned in his philosophy in the observation. So always keep it in mind that whatever I've just mentioned, not to go higher and higher and higher always. You need to know where to put the full stop, which is very important even in our practice. Okay, so next, if I say about doctrine on series of degrees was there, then came the law of vital force and reaction. This also Dr. Henneman has mentioned beautifully in his Organ of Medicine. Dr. Kent also took it from there only, and with this principle only, he came ahead further with the idea that what is next. Like if I say, let's say the patient is ameliorated, now what to do? Similarly, as we were going in series and degrees, it is not necessary you need to go to the higher reaction, higher potency at the same time. No, here we need to see whether that was the symptoms which are coming are actually aggravation, medicinal aggravation, or it's the change of the course of the disease. That is the law. How is the reaction of the vital force at this time, whether this vital force which is there is showing a bit of aggravation, and then we can identify that its reaction will come, that patient will get ameliorated afterwards. So this is how we need to see about. So there we were in the vital force and the reaction. Now, if I say, let's say the vital force has given us a reaction. So what will we do? At the same time, we have to see that if there was the relief without the homeopathic aggravation. So Dr. King says that it actually means that this may not be the complete cure. This may be just uh, just a separation of the symptoms. So that is why we all need to understand this thing, that what exactly this is. This will only come when we go through completely with the philosophies, with the observation parts that Dr. Kent has mentioned. Now I would like to move further in Dr. Kent's repertory. There, if I talk about the classification that has been mentioned for Dr. Kent's repertory, there are certain important points in it which we need to understand. Like if we talk about the Kent's concept of totality. Now, we all are aware, being homeopathic physicians, that totality is important for us. It is very much important for us. We not only give significance to the symptoms which are related to the particular part, but we also give significance a lot to the general symptoms of the patient, which includes both the mental being and the physical being. So keeping in mind those concepts of totality, we need to evaluate whole of the case. And the concept of totality given by Dr. Kent is again the same. You have to take the whole case, keeping in mind the whole of the disease, keeping in mind the whole of the individual, keeping in mind the whole of disease and individual together also. So let's say there are certain common symptoms also, but there are certain uncommon symptoms also. So these are these uncommon symptoms which we need to keep in mind. These uncommon symptoms will only take us to the individualization in the case. These uncommon symptoms are very, very important for us. Now, since we people are about to be budding doctors, so you need to understand this thing, that why exactly are these symptoms important for us. We all are aware these are the symptoms that actually help us in going ahead with the final selection of the remedy. All the symptoms which are there may pertain to the disease, all the symptoms which are there may pertain to the individual, but these uncommon symptoms help us in selecting the final remedy. Okay, so as we all know, there are certain general symptoms. So those general symptoms actually give us a picture of the person. If we talk about the particular symptoms, so obviously those particular symptoms are giving us the picture of the part which is affected. And if there are certain common symptoms in the disease, in the patient, so these common symptoms help us in reaching the disease part of the individual. So there we need to understand that all the symptoms which are whether pertaining to the person, which are whether pertaining to the part of the individual, which are whether pertaining to the disease of the individual, all are important for us. So all these generals and specifically the uncommon particulars, all these symptoms are important for us, and we need to identify, we need to give them preference while selecting the remedy. But at the same time, we all know that Dr. Kent always gave a major importance to general symptoms, because he has always said in his philosophy, he has always said in his repertory that general symptoms are very much important for us. It is not only about the generalization of the symptoms that we've read in the earlier repertories, that a, a sensation is there in one part, it is there in second part, we just consider it as a generalization of this sensation. But Dr. Kent has said that general symptoms should take their own priority, and then they should further move ahead. So if I talk about the hierarchy of symptoms mentioned by Dr. Kent, what you will find is that importance has always been given to the mental symptoms by Dr. Kent. And there in mental symptoms also, we have three categorizations where we can understand all what one should get preference according to Dr. Kent. So even in mental symptoms, the well, that is the emotional symptoms where we have love, hate, jealousy, these kinds of symptoms are there which come under well. Then there are symptoms which are of understanding. So if I talk about understanding, there are confusion, there is dullness, there is delusions, all these, not dullness, sorry, there's confusion, there is delusion, illusion, hallucinations, all these will come under understanding of the person. Then I come to the memory part, where you will see dullness, forgetfulness, absent-mindedness, all these kinds of things will be covered under the memory part. So the first preference is always the mental symptoms for Dr. Ken. In it, again, the will, the understanding, and the memory. And then we move further to the physical symptoms, which get the next preference in the Dr. Ken's philosophy also. So among the physical symptoms, the first one which comes is the sexual sphere. Now for this sexual sphere, it includes the menstrual symptoms also. It includes general other aggravation, amelioration, etc. also before and after the menstruation. All those things are covered under the sexual sphere symptoms. After that comes the appetite. The appetite not only includes the general appetite, it also includes the food intolerances, it also includes desires, it also includes aversions, any aggravations from any food. All these things are covered under appetite. Then come the thermal reaction part. And this thermal reaction, we all are aware how to come to the thermal reaction of the patient, but we also need to keep in mind that not all patients are either hot or cold. They are ambithermal patients also, but this gets the next preference in hierarchy of symptoms as said by Dr. Kent. Then came to the thing of particulars. Now these particulars symptoms then got this place here in Dr. Ken's hierarchy of symptoms, and these particulars here we need to understand about the uncommon particular symptoms also. Okay, so next we'll move forward. Now if I go ahead, I'll talk about the background on which Dr. Ken's repertory is based. We all are aware of the logics. We all have read about the inductive logic and the deductive logic when we started reading about Dr. Ken's repertory. Even we've read this thing in our Organ of Medicine also. We've read it many times. But here we need to understand what is deductive logic. Deductive logic means we are deducing something we are coming to a certain point after just removing the topmost part. So here the deductive logic means that we are going from generals to particulars. That is, we are coming from above to the bottom. Similarly, as was the case when I had mentioned earlier also, that even in hierarchy of symptoms, what we've seen, and even otherwise also, Dr. Kens have always went ahead from generals to particulars. We always have to keep in mind that general symptoms carry more importance when we want to go ahead with Dr. Kent's repertory. Or in your case, if you feel general symptoms are very much prevalent and the particular symptoms given by the patient are not that important, then you can go ahead with it. But at the same time, see, deductive logic means that doesn't mean that don't include the uncommon particulars. They also carry importance in Dr. Kent's repertory. Reading of rubric, you must all are aware. If you must see the repertory also, and you'll understand it. The bold letters mentioned in the repertory carry 3 marks, and they are the first grade. The italics one are the second grade, and the normal Roman ones are the third grade. Now, I hope you all are aware how we come to this first grade, second grade, third grade. But still, I'm gonna make it for you here only. The first grade symptoms are the symptoms which have occurred frequently during the provings. First point. Second point, again, they have been verified again and again during the provings. So that is how we come to the first grade and the symptoms. Similarly, the second grade ones that they came in the repertory, but they are not much verified. And then the third grade one, which came now and then during the repertory, but were recorded or not much confirmed during the reprovings. So this is how we come ahead with the grading of the symptoms. Each and every repertory has certain different grading for the symptoms. Like Dr. Kent has 3 grades of repertory. If you go to Burger Boning Husband's repertory, they have 5 grades of arranging the rubrics, so arranging the medicines as per the rubrics. So that is how we actually come to know about for that to understand, we first need to understand what philosophy they are carrying, how the things are mentioned in their philosophies. Then only we can understand why they have done the grading in this form. Each and every repertory has different gradings. As I've told you, BBCR has 5. Even if you go to Buric repertory, you will find a different kind of a grading system there. So that is how we just go ahead with the grading. But it is important to remember, because when we want to go ahead further for the repertorization, we should know what gradation is carried by the certain repertory and how it is mentioned in the repertory also. Now, again the same thing, if we come to Dr. Ken's repertory's plan, as I told you earlier, it was mentioned with Dr. Lippes. The plan was the same as taken by Dr. Lippes, although it was worked furthered by Dr. Kent, but the initial basic plan that we had was of Dr. Lippes. There also, again, the principle same has been followed. We'll go from general, we'll start with general, and we'll come to the particular remedy. Okay, so that is what was the main principle that we followed. This I'm just going to brief you a little about Kent's repertory, what all important things and how are they mentioned in it. So there have been total of 33 chapters in total in Dr. Kent's repertory. Although some people take it this way that there are 37, but I'll come to that point. It is exactly 33 chapters which are there in the repertory. You'll find since the generals carry an importance in Dr. Kent's repertory, mental symptoms carry a great importance in Dr. Kent's repertory. So this repertory starts with mind and it ends with generalities. That doesn't mean that generals have been put to the last. No, actually in Dr. Kent's repertory, if you see the things, you'll see it starts with mind. Then again, after that, you will come ahead that all the other chapters are arranged anatomically. So that is after the mind, you will see the chapter which is there is vertigo, then head, then eye, then vision. So basically the chapter and then it's the further divisions. So that is how the things are arranged anatomically from head to toe, but starting with the mind and ending with generalities, because there have been certain changes in the plan, the way rubrics were arranged, that is certain difference in generalities chapter which is there in the repertory. Now, why I was talking about 33 and 37 is one such reason for that is like if you see that the urinary organ is actually one chapter in the repertory, but it is further divided into 5 chapters, which is bladder, kidney, prostate gland, urethra, urine. So some people consider these as 5 chapters and they say it is 37 chapters, but actually it is one chapter in itself and thus come out to be 33 chapters. It is further subdivided into 5 chapters. So that is how the things are arranged. Also, one of the major important things about this repertory is that both genitalia, male and female ones, are mentioned as separate chapters in Dr. Kim's repertory. In some of the repertories, it is same. First, even in genitalia, they've given first male, then female. In certain, the symptoms are common, but in Dr. Kent's repertory, both are separate chapters. First, there is genitalia male chapter, and then we have genitalia female chapter. So this is how the chapters are divided in Dr. Kent's repertory. Next, if I talk about the arrangement of rubrics. Now, I would request you all to all have a look at the repertory and have a look at the way the rubrics are arranged. I'm trying to explain you, but you'll understand it much better when you'll have a repertory book with you. Always keep a repertory book in the class of repertory. You all know that is the rule of the class. Never come to the repertory class without a repertory. So all those who have the repertory, I would request you to give a look at the repertory and see all the rubrics are arranged alphabetically in all the chapters of Dr. Kent's repertory. All rubrics are arranged and they have moving from generals to particulars, the same way as was the plan initially mentioned. Each rubric is followed by its sub-rubric. And next is first this is a rubric, then you have certain group of remedies under it, certain group of medicines under it, and after those medicines then you have the sub-rubric, and then the sub-rubric is again given with certain group of medicines. Now when I talk about this group of medicines, this group of medicine has been given grading. As I told you earlier, the 3 grades that were mentioned in the Kent's repertory. So all these rubrics have been further, all these medicines have been given grading first, and then the further sub-rubrics are mentioned, which are then again given the grading. And these sub-rubrics are actually followed by STME. Now, what is this STME? Always remember, this is very important. It actually completes a symptom. Even when you are taking the symptomatology, never forget to complete STME for any symptom. This actually stands for STME stands for site, time, modalities, and extension. I'll take each one of them one by one. Like if I'm talking about side, right side, left side, this is how, and where it is not possible to mention the side. Like if you go through the Kent's repertory in the back chapter, you'll see side is not mentioned. They have directly come to the next extension of it. That is the next thing of it, which is the time. Similarly, in all those places where right or left is not possible, like in the head chapter, they have not mentioned right or left. In the head chapter, what they've mentioned is head and then the regions, the temporal region, the occipital region. That is how they've mentioned it further. But all those things are also always arranged alphabetically. Similarly, the time is somewhere, the time is with specific time period like 4 p.m., 5 p.m. But somewhere the timings are mentioned as morning, forenoon, afternoon, evening, before midnight, after midnight, midnight. But so similarly, these time periods are also arranged in a specific way in these things in all the, and it is followed in all the rubrics. Certain chapters do have certain variations that we'll read further when we'll study about it. Certain chapters do have certain variations, but most of the places Kent's Repertory has followed this kind of an arrangement. Modalities, you all are aware, the aggravation and the amelioration part of the modalities, and also not only aggravation and amelioration, along with that you have alternating factors also in this. If I talk about extension, the similar thing that we also know all everywhere, like mostly if you'll find the extension rubric is there in the pain chapter, in the pain rubric, pain extended to this, pain extending to this. So that is how all these rubrics are arranged in Kent's Repertory. This will be more clear when you go through the repertory. In the next class, when I continue with this thing, I'll tell you about the way these things are mentioned. How will I show you certain rubrics, I'll show you certain sub-rubrics of it. By the meantime, I would also request you all to go through the rubrics, go to different chapters of the rubrics. If not majorly, then at least go to pain section of every rubric, every chapter, and you will be able to understand how the rubrics are mentioned, how their sub-rubrics are mentioned, how their site, their modalities, their extensions are mentioned. Except pain, if you want, if you can go through other rubrics also, even in those chapters you will find rubrics, all the rubrics are arranged this way only. They have their STMEs along with them. And how will you know about it? Only when you go through the repertory again and again. So I request all of you to, till the next session, go through this repertory again and again, read different rubrics again and again. Just start reading, just take one page and see how the rubrics are followed. Even if you read one page on 2 pages on a daily basis, you will be able to understand this thing very clearly. So this is my request to all of you to go to the Kent's Repertory. Whatever we've done today, go back to it. Try and follow those things. Try and correlate the things which have been mentioned in this presentation to the book, and understand what all things are, how the things are correlated. That is how only we can learn more about the repertory. So today I'll be finishing my lecture here only, my session here only, and we'll move further with the next session. Then I'll make you aware about certain differences that we have in this Dr. Kent's Repertory, what all are the uses, where all we can use it, how we can use it, how to work over with the cases in Dr. Kent's Repertory. But by the time, do go through the repertory to understand more about it. Thank you very much. All of you, take good care of yourself, your family, stay home and stay safe. Thank you.